News tonight, a warning from a local doctor about what she's seeing in the emergency room. Dr. Meghan Martin is a pediatric emergency medicine physician at Johns Hopkins All Children's Hospital. Earlier this month, I saw a video she posted on social media. This video right here. She talked about the increase in injuries they're seeing related to both e-bikes and e-scooters. So I met with Dr. Martin to have a conversation about what they're seeing in the ER and why she's concerned. And by the way, we don't know which e-scooters or e-bikes were involved in the accidents or if the kids owned or rented them. So the video you're about to see just shows some of the ones available to rent around the Tampa Bay area. Here's what Dr. Martin told me.
It's something that I want to raise the alarm about because I think parents need to know that these are not just like bicycles that kids are riding. There's more power that's behind them. They're going faster. We need to take these more seriously.
When did you start to see this increase?
We've seen this increase over the last couple of years, maybe 3 or 4 years, but it seems to be increasing year over year, and we're just seeing a ton of these injuries now. I feel like almost every other trauma is related to an e-bike or an e-scooter.
And what do you tell parents when these kids come in? What's that conversation like?
I think it's really important to think of these e-bikes and e-scooters almost like motorcycles. Kids need to be in an appropriate safety gear. They should be wearing helmets. They should be wearing not flip-flops or sandals, but full foot sneakers, covered shoes, covered toes. They should also be in long pants and long sleeves in case they were to crash. I made this video because I really think it's important for kids, parents, and lawmakers to know that this is a big deal. We're seeing a lot of these injuries, and maybe we need to consider some legislation going forward to help protect not only the drivers, but also these kids on e-bikes and e-scooters.
And Dr. Martin tells me the trauma alerts are often kids on e-bikes or e-scooters involved in crashes with cars. She's also seeing a lot of kids coming through the front door after they've gone over the handlebars with injuries to their face, broken arms, scrapes, and bruises. And to give you some perspective, here are the numbers from Johns Hopkins All Children's Hospital. And these are only patients who were admitted to the hospital because of their injuries or transferred there by ambulance. So they don't account for injuries where patients could go home same day. You can see here in both cases, 2025 is on pace to have more than the previous 2 years.